Y nos encontramos aquí en la oficina del doctor Vincent Preziosi, que lo pueden encontrar en orlandochiropractors.com y también en Facebook en Orlando Chiropractors. Dr. Preziosi, thank you so much.
Thank you for having me.
Thank
I've wanted to
you.
come on for a long time. We finally did it.
Finally.
Very good.
La entrevista va a ser en inglés, les voy a poner subtítulos, pero quería que nos sintiéramos cómodos, así que, y sacarle más información. Dr. Preziosi,
Yes.
I understand you've been practicing chiropractic for about 35 years?
Yes. Is it really that long? Yes.
That's what I read.
About 35, 36 years been practicing in Orlando here. As you know, I've got two offices, one on the east and one on the west side. I'm a solo practitioner, so it's just me and my wonderful staff.
An
And here we are.
excellent staff.
Thank you so much.
May I say so? I'm very impressed. That is very important to me.
Yes.
The teamwork is, it's like clockwork.
We try. We're very customer service oriented, and I think after 35 years we have it down really well. But patients come first, and if you take care of them, everything else falls into place. That's what I believe.
Doctor, I'm going to start from the beginning.
Okay, let's go.
What is chiropractic?
Chiropractic, yes, is a science. It's a natural science that treats musculoskeletal injuries, mostly muscle, ligament, and spine-related injuries. It could be from an auto accident, a whiplash. It could be from a sports injury. It could be from a fall at home. So any of those that are going to put a strain, sprain, or an injury to the spine or the supporting structures, that's what we specialize in. So pretty much anything other than a fracture or a dislocation relating to the spine, shoulder, knee, or extremities, we can take care of. And it's treated conservatively with therapy, rehab, massage. We don't do injections, we don't do medicine, and we do mostly a holistic approach is how we address it. We want to rehabilitate you, we want to get you back to the way you were as much as possible. Yes, we do work with a lot of orthopedics and specialists in town that can take care of the medical side, but from a chiropractic standpoint, it's mostly a natural approach.
A patient doesn't feel well, had a fall, had an accident, something happened that all of a sudden they're like told to go to a chiropractor.
Right.
They call here, they call the Windermere office, and what happens? Do you actually send them for diagnostic x-rays or even an MRI? Or do you actually, just by looking at them, you know what's wrong?
Good question. Yeah, no, this is a very good question. Generally, the patient comes in, we evaluate them. After the evaluation, then I decide what else needs to be done. Can I just treat them in the office conservatively? Do I need to order x-rays? Do I need to order MRIs? Do I need to send them to an orthopedic, a pain specialist? So depending on the type of injury, the severity of injury, that will tell me, like I said, we can just keep it in-house, or we need to get additional support with testing and other physicians. Yes. So every case is different. It's not everyone comes in and we do A, B, and C. So each case is completely have a different profile.
And I was very pleasantly surprised to see it's just not seeing the chiropractor, getting something done and walking out. There are several other practitioners within this office. There is acupuncture.
Yes, Dr. Lou.
Dr. Lou. There is a massage therapy,
right.
Rita. And there are other
exercise rehabilitation.
The name escapes my mind right now. What is her name?
Well, right now it's Deidre and Caitlin. Yeah. Yes.
She's new. So basically, depending on what
the type of injury, severity of injury, exactly. Everybody fits into a different category, and we just add the different modalities and the different referrals as necessary.
Yes, and both offices, because I haven't been to the other office yet, both offices are just pretty much the same, and the same well, not the same practitioners, of course. You have a double staff over there?
Right, we have the same staff for the most part. Dr. Lou does not practice acupuncture over there, but everybody else from here follows me over there, the massage, the rehab, and we all have the same employees.
So what's gonna happen when my people here start flooding, I was gonna say inundating, flooding the office, and you guys have to decide if you're gonna do double shifts over there?
We're going to be ready, let me say that. We have it down real well. I've got a great staff. I have more than enough employees to take care of the extra people. We can get them in on the same day if necessary, generally the next day, the latest. So when you're in pain, you don't want to wait a day or two to be treated. You want to be treated right away, and we're going to take care of that. So we're prepared. We've got plenty of staff, and of course we've got the facility to take care of them. So we're ready. Just give us a call.
And some of them are actually referred either by their attorney, as it happened in my accident case, or they're actually referred by the insurance company.
Could be. The patients come from all different ways. Many are referred from other patients that have been in, relatives, family, friends. Of course, the auto accidents very often are referred by attorneys. Insurance companies refer us patients. We do workman's comp, slip and falls, auto accidents, sports injuries. So they come from, the majority is from patients referring, family and friends would be the majority. Yeah.
I understand that in cases of auto accidents, by law, the person has to seek medical attention within 14 days.
That's correct.
Does that also happen with, I would say personal injury by default doesn't, but in cases of workers' comp, is that also?
No, that law is only pertains to patients that have been involved in auto accidents. So if you had an auto accident, you must either go to the hospital, a chiropractor, or your family physician before 14 days. Otherwise, the insurance company does not have to pay for the benefits relating to that accident. So it's very important that you see somebody within 14 days of any injury, auto-related. If it's home and it's under your health insurance, or it's work, or it's sports or something, you have plenty of time. There's no time restraints on that.
Excellent. I had a feeling that maybe workers' comp always fell under that umbrella because there's some insurance involved.
Right, there is some time restraint on the workman's comp. I think it's a year, which is much more than the 2 weeks for an auto. So the most important aspect is remembering, if an auto, get in there as soon as possible.
Excellent. Anything else that you would like our audience to know?
Well, we can talk about some of the different modalities that we offer. As we were talking with Lisa, we have massage therapists full time, and massage is very beneficial for any kind of muscle spasm, increasing circulation, reducing that inflammation and contraction of the muscles. Of course, we have physical therapy, electrical stim, laser to reduce inflammation, reduce spasm, sound wave. We've got waterbed, hydrobed for the muscle spasm. We've got spinalator, intersegmental traction to kind of decompression to help restore flexibility in the spine. Exercise rehab to strengthen and the areas that have been injured, the muscles and ligaments, and to increase flexibility. So someone's there to guide you with each part of the way. A lot of clinics don't have rehab. I think that's a very important part in recovering, is to fix it, but then you want to strengthen it and get that flexibility back. So that's the rehab part. Acupuncture has a part. It's a very natural, very old practice of reducing pain, particularly when it's nerve related. And it's not for everybody and it doesn't help everybody, but when it does, it's really miraculous. We do, if I might mention, over the past 6 months, I brought in my brother-in-law who's a medical doctor, and we offer some limited pain management. So once a week, my doctor, Preziosi, is here, and he can offer medication. He's a medical doctor, and we're also doing trigger point injections for myofascial or muscle-related problems only. So it is limited. It's not epidurals, it's not facet, the deeper injections, but it is trigger point for muscle spasm and inflammation that won't respond to conservative care like the therapies I just mentioned.
But that has only been recently, and that's one of the reasons that we're here, to let our people know that now we're I almost feel like I'm at home.
You're working here now, what's going on?
So I want people to know that the office is also offering pain management. Sometimes some of us are such believers in actual medication and injection that we don't want to go to a chiropractor because we know already that they're not going to give us something that we can just pop in and walk away.
Everybody wants that quick fix,
Yeah.
the magic pill. And my feelings about medication, I'm very open to that.
Yeah.
I've referred to medical and specialists for many, many years when it's appropriate and when it's necessary. But you have to really appreciate what it's doing.
Yes.
A muscle relaxer is not really going to take your muscle spasm away. A pain reliever is just masking the problem so you're not suffering while you're healing, which is wonderful.
Yes.
We don't want the patient to be suffering. Anti-inflammatories, I think, are the most important. You bring the inflammation down, the healing is more effective and faster. So the anti-inflammatories probably have the biggest role from a medicine standpoint, I think, than any of the others. The other ones are more just to make you feel better in the meantime.
Yes.
You know what I'm saying? So medication has its part. I'm a big believer in that, but start with conservative care and add on as you need to. Medicine, injections, surgery, things like that.
And have injuries been so severe within all these years of your
Right.
practice? Have injuries been so severe that you have had to refer patients to, like, let's say, a surgeon?
Yes, many patients. Well, again, I've been practicing for 35 years, so I've seen maybe 20,000 patients over those years. When I say many, it really is a small percentage, but I'm very aggressive in getting diagnostic testing, MRIs, CAT scans, to really see what's happening rather than guessing and treating without knowing for sure what's happening. Based on that, if the patient has a herniated disc or they have an injury that's severe enough that I am not helping or fixing, I'm not going to keep that patient coming in. I'm going to get other people to help me, the orthopedic, the neurosurgeon, the pain specialist. So a lot of patients that don't respond to conservative care, which is the first level, which is me, do respond to pain management, right? Do respond to medication. So I would say 95% with some conservative medical and conservative chiropractic will respond. It's that 4 or 5% that may need more invasive surgery, some ablation, some different procedures that are going to require
probably they
aggressive
wouldn't
care.
have come here if that was the situation to start with. Is that correct? I mean, if somebody really had a real bad car accident, they pretty much go to the hospital, and from there they're referred to a physician. Orthopedic?
Correct, yes. And if it's not surgical, then they should go backwards. Then they should go back to the chiropractor and get the therapy, get the rehab, and get the conservative pain management if necessary. So if it's really bad, of course, start with the hospital, get evaluated. They've got all the tools, all the diagnostics right there in one setting. And then they'll probably send you to a specialist. If they, as I said, if the specialist doesn't feel like it's surgical, then don't just leave it at that point. Go and get the necessary conservative care that you need to fix what we call soft tissue injury, the muscle injuries, the ligament injuries, the structural or the spinal injuries from a conservative standpoint. You follow me?
Yeah.
Once surgery has been ruled out.
Excellent. Yes, it definitely has to. Doctor,
Talk.
high heels, good or bad?
You know the answer to that. Of course, high heels look wonderful on the women when they're wearing them, but it does accentuate the lower curve in your spine, the lower back lumbar curve in your spine, and that's going to put stress to that area. And over a period of time, many women do start having lower back pain from wearing the heels. When someone has a lot of lower back pain and they wear heels on a regular basis, I usually recommend get off the heels for a while, take that extra stress off. They look great, but they're not practical.
I stopped wearing high heels a long time ago, but
Today?
yeah, today I don't even go there.
I really appreciate Lisa and being on the show and saying hello to many of my patients from years over the past 35 years. Just understand that our primary goal here has always been and will remain to be to take care of the patient first. I am here every day. I never miss work. I'm the only doctor that you're going to see. Of course, I've got a great staff, as you know, and I'm only as good as my staff. So we are here to answer your questions and take care of you to the best of our ability each and every time that you come in. We don't overtreat. we keep the fees reasonable, we keep your treatment program reasonable. If you're better, I'm not going to keep you coming in. So understand that I'm going to treat, and this expression is used often, I will treat each and every one of my patients like I do family.
Well, it does feel like that. I'll tell you right off the bat, it does feel like that. He's very personable. I would say he even knows everybody by name, knows what everybody had. Well, I know you look at the reports, but still, you feel that. And
Right.
that is a difference, that does make a difference. So, Dr. Preziosi, thank you so
Thank
much.
you. Thank you very much for having me on, and I look forward to coming back on again. hopefully
Yes,
in the
we
future.
will.
And next time, I think maybe we'll address some specific conditions, maybe sciatic, whiplash, lumbar discs, herniations.
More
so
specific.
we have a lot of things
More
to cover. Yeah.
specific. I just really wanted, because to me it's always been a mystery practice, to be honest with you. So
Chiropractic, you
yes,
said. Yeah.
yes, I came here because I was told so, but I had no clue. So I figure the same way some of my audience might be. So that's why I like starting from the beginning and
introduction.
educating them and letting them know what it is about, what can they expect.
Right.
And yes, we're gonna go through
That's
some
great.
specific areas. and
Yeah,
things.
we'll go more specifically, and we'll be on again soon. But for your listeners and watchers, maybe they can email you some questions they may have for me. I'll be glad to address anything that you have. By the way, we do take all of the insurances except Medicare. We're not doing Medicare, but United Healthcare, Aetna, Blue Cross, Humana, we're on all the plans. So feel free to contact us just from a general health insurance. We do specialize in auto accidents, but we treat many other patients that are not auto related. Yeah.
And it is very easy when you have an auto accident. You just provide that insurance information, and the office takes care of the rest.
Take care of it. Yep.
So it's very easy, very well streamlined, and the staff is excellent. They are bilingual, by the way.
Thank you for mentioning that. I speak some Spanish, better in the office than I do at home, as far as discussing with patients, but like she said, I have all my staff are bilingual, so there's never a problem speaking with my wonderful Hispanic patients.
Excellent. So now you know Dr. Vincent Preziosi, Orlando Chiropractors. The address is right here.
Is it right there?
And yeah, it's
see
right
it.
here, you see it.
Well, thank you for having me.
Thank you
And,
so much.
Send in some questions to Lisa. We'll answer them on air or by email. And thank you very much. Everybody enjoy the weekend coming up.
And back to the studio.